Have you ever noticed your hands or feet feeling cold, even when it's not cold outside? Or maybe you get a weird tingling sensation in your legs for no reason. These might seem like harmless quirks, but they could be early warning signs of poor blood circulation, and that's something you should never ignore. Blood circulation is like your body's internal highway system. It sends oxygen, nutrients, and hormones to every organ and tissue, while helping remove carbon dioxide and waste. But just like traffic can slow down due to blockages or poor road conditions, your circulation can weaken as you age, and the results can be far more serious than just feeling a bit chilly. As we cross the age of 50, our blood vessels may stiffen. Plaque can build up in our arteries, and heart efficiency can decline. These changes happen gradually, and the signs often appear so slowly that they're easy to dismiss. You might think you're just tired from aging, or that numbness in your foot is just from sitting too long. But what if it's your body's way of trying to warn you? Ignoring poor circulation symptoms isn't just risky, it could be life-threatening. Reduced blood flow is linked to conditions like peripheral artery disease, stroke, heart failure, and even memory loss. That's why in today's video, we're breaking down the 7 early signs of poor blood circulation that you must never overlook, especially if you're over 50. These aren't just facts. They're real-life red flags that could help you take action early. Make sure to watch until the very end. Some of these signs might already be affecting you or someone you care about. And sign number 6 is one that surprises nearly everyone. Let's dive in. Sign number 1. Cold hands and feet. You might brush it off as poor weather or just being naturally cold, but frequent cold hands and feet can be one of the most overlooked signs of poor blood circulation. When your heart isn't pumping efficiently or your arteries are narrowed, your extremities, especially fingers and toes, are the first to feel the drop in blood flow. Here's why your body prioritizes vital organs, like the heart and brain. So when circulation decreases, your hands and feet get less warm, oxygen-rich blood. Over time, this reduced blood supply can make your extremities feel persistently cold or even numb. But it's not just discomfort. Chronically cold extremities can also mean your body isn't delivering enough nutrients to your skin, muscles, and nerves in those areas. This can lead to dry skin, brittle nails, slower wound healing, and even infections. And don't ignore it just because it seems minor, especially if you notice it happening more often, lasting longer, or affecting one side more than the other. It could be more than just bad circulation. It could signal peripheral artery disease, heart failure, or even early nerve damage. So what should you do if you're experiencing cold hands or feet regularly? First, check your environment. Is it genuinely cold, or are you the only one feeling it? Second, keep track of how often it happens and whether it comes with other symptoms like numbness or skin discoloration. Most importantly, don't self-diagnose. If this is a new or worsening symptom, talk to your doctor. It could be your body's quiet way of telling you something is off, and early detection is always better than late treatment. Sign number 2. Numbness or tingling. Have you ever felt that strange pins and needles sensation in your hands or feet, even when you haven't been sitting on them? Numbness or tingling, especially when it happens often, can be a red flag for poor blood circulation. Here's what's going on. When blood doesn't flow properly, it struggles to deliver enough oxygen and nutrients to your nerves. And when nerves don't get what they need, they start misfiring. That's when you get that odd buzzing, tingling, or numb feeling, sometimes out of nowhere, and sometimes triggered by something as simple as standing up. This symptom can show up anywhere, but it's most common in your fingers, toes, arms, and legs. It might start off mild, just a weird sensation here and there. But if ignored, it can become more frequent, more intense, and even affect your ability to feel temperature or pain, which increases the risk of injury without you noticing. It's important to recognize that numbness and tingling can also be signs of other serious issues like diabetes or nerve damage. But circulatory problems are one of the most common and underdiagnosed causes, especially in older adults. What makes this sign tricky is that many people dismiss it thinking it's just a posture issue or temporary discomfort. But if you're experiencing it regularly, it's your body asking for help. Keep track of where it happens, how long it lasts, and whether it happens more during rest or movement. A quick test if shaking out your hand doesn't relieve the sensation, or if the numbness seems to creep up or down a limb, don't wait. Consult a healthcare professional to rule out circulation issues early. Sign number 3. Swelling in the lower extremities. If your ankles, feet, or legs often feel puffy or tight by the end of the day, it's easy to blame it on aging or standing too long. But here's the truth: persistent swelling in your lower extremities is one of the most visible signs of poor blood circulation, and it's one you should never ignore. When blood isn't circulating properly, fluid can start to pool in your legs and feet instead of being carried back to the heart. This condition, known as peripheral edema, causes swelling that can feel heavy, achy, or even tender to the touch. You might notice your socks leaving deep marks on your ankles, or your shoes feeling tighter in the evening than they did in the morning. In older adults, this kind of swelling is often related to weakened veins or a sluggish heart that isn't pumping effectively. In more serious cases, it may signal congestive heart failure, deep vein thrombosis (DVT), or chronic venous insufficiency, all of which require medical attention. What's concerning is how often people ignore it. Many assume swelling is just part of getting older, but when fluid retention becomes regular, it's your body waving a red flag. Especially if the swelling is one-sided, gets worse throughout the day, or comes with skin discoloration or warmth, it's time to take action. To reduce mild swelling, elevating your legs and staying active can help. But don't just treat the symptom, you need to address the underlying cause. Chronic poor circulation isn't just uncomfortable, it can be dangerous. If you've noticed swelling becoming more frequent or severe, talk to your doctor. They can help determine whether it's related to circulation and what steps you can take to manage it early and effectively. Sign number 4. Fatigue and lack of energy. Everyone feels tired from time to time, but if you're constantly dragging through the day, even after a good night's sleep, it could be more than just getting older. Chronic fatigue is one of the most subtle yet impactful signs of poor blood circulation. Here's how it works. When your circulation slows down, your body doesn't get the oxygen and nutrients it needs to function at full power. Muscles feel weaker. Brain fog creeps in. You may feel like your limbs are heavier, or like simple tasks, walking, cooking, or even getting dressed, take more effort than they used to. Poor circulation means that your heart has to work harder to push blood through narrowed or stiffened arteries. This extra strain can leave you feeling exhausted more quickly, even during light physical activity. And if your brain isn't receiving enough oxygenated blood, that mental clarity and sharpness you used to rely on can start to fade. It's important to pay attention to what your body is telling you. If your fatigue feels out of proportion to your activity level, or if rest doesn't seem to help, it might be time to look deeper. Especially if this tiredness comes with other symptoms like cold hands, swelling, or tingling. Don't just chalk it up to aging. There's a difference between natural slowing down and a circulation issue silently sapping your energy. Getting a medical checkup, improving your cardiovascular health, and staying active can all help restore your vitality. The key is not to ignore it. Constant fatigue isn't just an inconvenience. It's often a clue that your body is working overtime just to keep up. Sign number 5. Muscle cramps during activity. Have you ever felt a sharp, sudden cramp in your calves or thighs just from taking a short walk? Or maybe your legs seize up during light exercise, even though you've been active for years. Frequent muscle cramps during movement are a strong sign that your blood flow isn't keeping up with your body's needs. When you're active, your muscles demand more oxygen and nutrients, and they need it fast. But if your arteries are narrowed or partially blocked, blood can't reach your muscles efficiently. As a result, the muscles begin to suffocate, and the painful cramping is your body's way of begging for more circulation. This type of pain, often called intermittent claudication, tends to show up during walking, climbing stairs, or standing for long periods, and usually improves with rest. It's especially common in the calves, but it can affect your thighs or buttocks too. People often confuse these cramps with muscle fatigue or dehydration, but if they occur regularly, worsen over time, or feel more intense on one side, they could point to peripheral artery disease (PAD), a serious circulatory condition that affects millions over the age of 50. The danger lies in ignoring these signs. If untreated, poor circulation can progress to chronic pain, ulcers, or even tissue damage. So what can you do? Start by noticing the pattern. Does it happen more when walking uphill? Does the pain fade quickly when you stop? Keep a log and bring it to your doctor. And remember, your legs shouldn't feel punished just for moving. Recognizing this symptom early can help you take control before it becomes a bigger health problem. Sign number 6. Slow healing of wounds. A small cut or scrape might not seem like a big deal until it takes weeks to heal. If you notice that your wounds are healing slower than they used to, it could be a warning sign of poor blood circulation. Here's why that happens. Your blood carries oxygen, nutrients, and immune cells that your body needs to repair itself. When circulation is sluggish, those healing agents arrive late, or sometimes not at all. As a result, even minor injuries like a nick from shaving or a scraped knee can linger longer than expected. This delayed healing isn't just inconvenient. It puts you at greater risk for infections, skin breakdown, and in severe cases, ulcers or tissue damage. For people over 50, especially those with other conditions like diabetes or high blood pressure, slow wound healing can be the first visible clue that something is wrong beneath the surface. One key area to watch is your feet and lower legs. If cuts, bruises, or even bug bites seem to stick around or develop scabs that don't go away, don't brush it off. Also, look out for dry, cracking skin that splits easily. This can be a result of poor circulation, starving the skin of moisture and support. Many people write this off as just part of aging or thin skin, but your body should still be able to heal itself effectively. When it doesn't, it's a sign worth paying attention to. Talk to your doctor if you're experiencing delayed healing, especially when it's combined with other symptoms like numbness, cold extremities, or fatigue. Acting early could prevent much bigger problems down the road and might just save you from complications that start small but end seriously. Sign number 7. Skin discoloration or bluish tint. Take a moment to really look at your skin, particularly your toes, fingertips, or the backs of your hands. Do they look unusually pale, blotchy, or have a bluish tint? Changes in skin color, especially a subtle blue or purple hue, can be one of the clearest visual signs of poor blood circulation. Here's what's happening. When blood flow is restricted, oxygen can't reach the surface of your skin as effectively. Without oxygen, hemoglobin turns darker, giving your skin that bluish appearance, medically known as cyanosis. It often shows up in colder parts of the body, like fingers, toes, lips, or even the nose. In mild cases, you may just notice your feet looking paler or slightly purple when you're sitting down for long periods. But if you stand up and the color doesn't return quickly, that's a strong indicator that your circulation may be compromised. In more advanced cases, skin might even appear shiny, thin, or tight, especially around the ankles or shins. This discoloration isn't just cosmetic. It tells a deeper story about your body's ability to deliver life-giving oxygen to your tissues. Without enough circulation, skin can become fragile, wounds don't heal, and infections become more likely. A good tip: press your fingernail until it turns white, then release. The pink color should return in less than 2 seconds. If it takes longer, or if your extremities are cool and discolored, it's time to take it seriously. Your skin is a mirror of your internal health, and discoloration is like an alarm bell ringing on the surface. Don't ignore it. Let your doctor know, especially if it's paired with other symptoms like cold hands, cramps, or fatigue. So now you know: cold hands, numbness, swelling, fatigue, muscle cramps, slow healing wounds, and even subtle changes in skin color. These aren't just random annoyances. They're potential early signs that your blood circulation isn't working the way it should. And the most dangerous thing you can do is ignore them. Your circulatory system powers everything from your brain to your toes. When it slows down, your energy drops, healing stalls, and your entire body suffers in silence. But the good news: you have the power to spot the signs early and take action before it turns into something serious. That action can start today. Start by listening to your body. Make a note of any recurring symptoms. Talk to your doctor if you notice more than one of the signs we covered. And most importantly, don't wait until it becomes painful or obvious. Early detection is the best protection. If this video helped you recognize a symptom you've been ignoring, or helped you understand what's happening in your own body, then you're already one step ahead. And if you found this valuable, we've got plenty more waiting for you. At Medimint, we break down complex health topics into clear, simple, and powerful insights, tailored especially for people over 50 who care about living longer, feeling better, and staying sharp. So hit the subscribe button, give this video a like, and join a growing community that's taking control of their health one smart decision at a time. Because when it comes to your circulation, knowing the signs might just save your life.